So, Michelle, what would you say a wound is?
So a wound is really a disruption in the integrity of the skin. So it could be an injury to the skin, which can lead to problems with the underlying tissue. And lots of different types of wounds, for example, pressure ulcers. So people in hospital, people who are immobile can be at a greater risk of sustaining a pressure ulcer. And we have people with diabetes are at a greater risk of having diabetic foot ulcer, for example. And then you also have injuries that can occur. So, for example, someone may knock their leg on a table and maybe sustain a skin tear, and that skin tear could progress into a more serious wound, maybe even a venous leg ulcer if there is some underlying health concern there.
Yeah. So would you say that we could class wounds or categorise them into acute wounds, so like your trauma wounds, your surgical wounds, and your chronic wounds, so your diabetic foot ulcers, your pressure ulcers, your venous leg ulcers?
Absolutely, and different wounds and different wound types will take different periods of time to heal, and we'll need different types of treatment to be able to achieve that healing.
Absolutely, and there is a blurred line between the acute versus the chronic, because there is nothing stopping somebody having an acute wound that ends up being a chronic wound for them.
Definitely, and you quite often see that in practice where you do have somebody who had an acute wound, and then after a period of time that wound is non-healing, and then becomes a hard to heal wound, which we need to then be able to change the treatment objectives for that wound and the treatment plan to be able to heal in a different way.
Absolutely.